Hi there, welcome to familydoctor.expert. Today we're going to talk about shingles. So what is shingles? Shingles is a rash that we see every couple of weeks in patients, often on the torso, but sometimes on the back or the leg or even on the face. That's a blistery, painful rash, and interestingly it never crosses the midline. And the reason for this is the virus that causes shingles is actually the chickenpox virus. And the chickenpox virus lives in the nerves, just sits there for years and years. And then when you run down or your immune system's suppressed or just for no reason, it tracks down the nerve endings in what we call a dermatome, which is like a distribution of the skin nerves. So almost like a little stripe, and forms these painful blisters. So the important thing about it is that if we treat it quickly, so within the first 72 hours or even better in the first 24 hours, we can reduce its severity and also reduce the chances that you get a complication called post-herpetic neuralgia, which is where the rash goes, but you still end up with this sort of painful little patch of skin. So there's good reasons to get it treated. So there's a number of special situations that make us particularly concerned with shingles. If it's involving the face, particularly if it's anywhere near the eyes, we like to get an eye specialist involved pretty quick, smart. In pregnant ladies, we're not so much worried if a pregnant lady gets shingles per se, but here's the thing, we don't want pregnant ladies to catch chickenpox for the first time when they're pregnant. So if a lady who's pregnant is exposed to someone who's got shingles or chickenpox, that's something we're a bit concerned about, and she should have a chat to the doctor about what to do. Now there's a few things we can do to prevent shingles and actually to prevent chickenpox, because we've got a very good vaccine now that most of the kids are having as part of a routine at 18 months, but you can have it as an adult, and if you haven't been exposed to chickenpox, and that's only probably about 10 or 20% of people, because 80 to 90% of us have already had chickenpox. But if you haven't been exposed and you want the vaccine, new vaccines that your doctor can give you, and that will prevent you from getting chickenpox. So that's pretty much shingles in a nutshell. It can be very painful. There's things that we can give you such as capsaicin ointment and analgesic medications if you've got pain. But the important thing to remember is to come to your doctor early and get the antiviral treatments to try and head off trouble if you get shingles. So that's all from me at familydoctor.expert. As usual, don't just rely on this video. If you think you've got a problem, go to your regular doctor and get it assessed properly. Thank you. Goodbye.